Welcome to the Critical Therapy Antidote podcast.
Well, welcome everyone. I'm Dr. Michael Olan. It is an absolute pleasure, and I'm absolutely excited to be with two guests today who I don't feel like need any introduction as far as our CTA members are concerned. Our own Christine Sefein and Leslie Elliot Boyce, the host of the Solid Ground podcast and of the Radical Center. Welcome, both of you. I'm so happy to have you here.
Thank you so much, Michael.
Thank you. Great to be here.
Yeah, CTA has been super important to me from since 2020 when I found CTA. It's been an absolute lifeline, and I'm just delighted to participate in any way.
That was fantastic. And, as Christine and I often talk about, there are over the last couple of years, there have been a couple arcs for people, whether they are looking at things through the lens of the education landscape, the academic landscape of what's been going on the socio-political front. And then there are places like your podcast, the CTA platform, that are available for people who are more concerned about the specific topics related to mental health and the intersection with greater culture. And so it's so great to have you here because you also have an arc that I have to say, early on when I was first trying to figure out what was going on in my education, my career, what the shift and tone changes meant and what were happening, and trying to check in on my own stability, sanity, how I was making sense of things. You both were there, whether you knew it or not, on my YouTube feed, telling me that I wasn't alone and that what I was seeing absolutely wasn't in my head. And I really wanted to have this conversation because I think, and I've shared this with both of you, that we have a rare opportunity to really crystallize and capture kind of the changes and the ebbs and flows of the cultural landscape in the field of mental health in particular over the last couple of years. I don't claim to know what the current temperature is of the room in a classroom right now, but I have been in different temperatures. And what I've noticed through talking to different people from different academic backgrounds or people who have dealt with, let's say, the ideological intrusion over the last couple of years is that there's quite a range and quite a spectrum in terms of how much of that people actually ran into in their schooling. I know for you both started in this space coming up against that in different ways as a student and as a professor. And I really wanted to take a chance to get a retrospective here to be able to look back and say, okay, here's where we are now, whatever that means. But also, where did you both start with this? How did you both find yourself in this space? And what were your initial intentions in terms of your career aspirations? I find it hard to imagine that this is exactly what you had imagined, because who could have seen this coming in some way?
Do you want to start, Christine?
I'll let you start.
Okay. So, gosh, when I back in undergrad, I majored in psychology, and I considered counseling at the time, but I was kind of going with a pre-law intent. And so I went ahead and went to law school. I stopped 2 years, or a year and a half in. I took a leave of absence because I was thinking what I really wanted to do was more client-centered work, and all of this research and writing and the legal field with all of its adversarial nature. I didn't want to do that anymore. I thought now I've gotten a good look at what this looks like, and I think I do actually want to go into counseling. So I took a leave of absence, and then it took me years to actually start graduate school. I raised a couple of kids, not fully, I'm still raising them, but I had a couple of kids and spent some more time working in the medical field before I went back to graduate school in 2019. And so law school, I left in 2010. So that's a big break. I wanted to work as a counselor. I wanted to just work with individuals, couples, families in a supportive capacity, helping people to sort of problem solve, figure out what they needed to do to get unstuck or to work through whatever it was that they were working through. And so my image of what it was to be a counselor was really kind of just that, just kind of being a process partner and a person who's alongside another person who's going through a challenging time. And my experience with counselors over the years had been pretty mixed, but I had seen counselors pretty much my whole life because I was put in counseling when I was a kid, which was a bad experience for me, and it actually informed some of my reservations around kids and therapy, which I'd be happy to talk about, but that's a side tangent. but I'd had some really good counselors and some really good teachers, and I'd seen the power of someone who really wants to take the time to listen and be helpful. I'd seen how that can help a person to make positive changes in their lives. And so that was really what I pictured for myself in terms of career. And when I went to school, when I started that graduate program, I was almost immediately shocked by the discrepancy between how I was being taught and what I expected from this field. It was one of my first introductions was around pronouns. One of the very first, we had to give pronouns in our group interview, and I just thought this is really odd coming from an applied psychology program to promote this illusion that we have to ask each other this question about, am I supposed to think of you as a man or a woman to every person that we encounter? And so they really pushed that very hard. But then the multicultural component of it was where it was uh, really, really alarming. And I don't know if you want to retread that ground. That's really been covered quite a lot. I've talked about it a ton. If you want me to go into it, I can. But would you like me to go into that a little or no?
I'm interested, one of the things that I'm interested in, and I'll definitely touch back on some of the things that up is I'm so curious about the experience, particularly after the fact, as we can recall it, from that first person perspective. So if you don't mind going into it a little bit, maybe that'll also add a little bit of texture, a little bit of context to some of the things we might discuss.
Oh, sure. Absolutely. I knew from undergrad studying these, I'd studied psychology at the community college level, and then I transferred to university and I declared psychology as my major. And I had to retake all my psychology courses because they wanted you to take all your courses in your major at their university, informed by their teaching. And so I had a lot of psychology courses at this point, all at the undergrad. Well, not all at the undergrad level. I actually had a teacher. My faculty advisor was the chair of the psych department, and she offered me the chance to take some of my classes with the clinical psychology master's program because she knew I was retreading old ground. She thought I might like the extra stimulation, and so I'd had a mix of undergrad and graduate psychology courses, and the poverty of quality in this counseling program was appalling to me. So having a teacher stand up in front of the room and explain to us the addressing model, this Hayes addressing model, where you're evaluating privilege and marginalization based on an acronym that for demographic characteristics, age, gender, sexual orientation, et cetera, nationality, all those things. And telling us and showing us with graphics and videos about how if you're a white counselor, you're privileged and your client is marginalized. And if you're, so these demographic level understandings of the individuals in front of us, it flew in the face of everything I'd been taught about human psychology and everything I knew as a human being about human psychology. These are just such incredibly reductive things. And we're having to read this Daryl Wing Sue book about counseling the culturally diverse, which is really kind of a zoology of personalities by race and cultures by race. So for me, it was really intimidating. I didn't know how to say, this doesn't make sense, when I'm looking around the room and seeing everybody nodding and going, yeah, my privilege, my privilege. It was hard to know how to say, I don't agree with this. Like maybe there's a more nuanced take, but I did. And I started it in letters to the teacher. She asked us to send her weekly letters, journals, to tell her how we were processing the information. So I tried to very diplomatically raise, I think that some of these are really broad strokes. I see what he's trying to do here, and it makes sense to take into consideration these identity characteristics. However, shouldn't we be talking about people in a more nuanced way? Shouldn't we go back to the idea that you can't know something of substance about someone by looking at the color of their skin? And I was ridiculed in front of the class for doing that. I was told that I needed to reparent myself, that I was a harm to my future Latino clients if I didn't change my attitudes about race, all for saying I'm not sure people really adhere to these stereotypes, and I think that you can have a variety of experiences regardless. So the silence was deafening when the teacher called me out for this. And at one point near the end of the course, I tried to sort of push back respectfully and gently. And I had another student tell me that we'd heard enough white voices. And so this was just like the absolute, like the crash down. It was actually a trans woman who said this to me, sitting next to me, said, "I think we've heard enough white voices." And then the teacher started sobbing about her emotional labor. And this was the quality of a course of a graduate level course that I was in. I did not feel any support from anybody for challenging these ideas. In fact, I felt like I was a bigot and I was wrong in that context. I had no support in that class. I wanted to leave the program after that. I did have a couple of people email me outside of class to say that they kind of sort of agreed with certain things that I was saying, but it was very soft. And it wasn't until I found CTA that I read Val Thomas's essay that she published in New Discourses. And I saw somebody else actually addressing these issues. And I was able to communicate with other people in the field and in counselor education who were experiencing what I was experiencing. And that was like you said, when you said that Christine and I and other people provided sort of a sanity check for you when you were going through that. CTA provided that for me. But in terms of the ability to really talk about these issues, I was actually really terrified just to make that first video because I had been told that I was centering whiteness and that I was a white supremacist. And, these were the kind of messages I was getting from the school.
And so from the outset, I'm kind of hearing almost like the process that I quite often hear when I talk to people about this, which is there are these kind of implicit processes taking place where they're using language in a very strategic manner, as though it's the status quo already. This language and what it suggests about our consensus reality is already set up in place. And you're hearing all of this. They're kind of bringing you in first with checking in on your pronouns, but then over time starting to bring in different conceptual models and different frames for you to essentially learn, because it is a graduate program, and then be able to, if you're learning, be able to apply this type of information at some point, meaning implying there's something positive or beneficial about this. And as you're watching your colleagues and classmates just kind of do what I often refer to as like bobbleheading experience at groupthink, where I've been a witness to this, and it can be very unsettling. You're watching each of the people around you just kind of fall in line, if you will, and you're feeling this sense of discomfort as you're going through it. You're watching everybody just kind of fall in line there, and on the inside, you're like, I don't agree here, and yet there's no sense of safety whatsoever for you to say anything. This is very much. I can almost feel the tenseness in the air, that there's definitely a consensus that's taken place, and there's no room for you to really gather your thoughts. And so you said you were writing journal entries as you were requested to, kind of like self-reflection journal entries, and that was part of the beginning of kind of drawing some attention to yourself, if I'm understanding that correctly.
Yes, and as I look back on it, and as I have looked back on it, I see this as a really deeply psychologically abusive process that we were asked to do, because one of the things that these journals were supposed to be about our own experiences of culture, but the way that we were the material that we were reading, that we were to reflect upon and then tie into our own lives, was this reductive, here's the white racial identity formation model, here's the black racial identity formation model, here's how you think as a white person, this is the kind of person you are. And so we're supposed to draw from our own experiences and write about how they related to these things. So I'm having as an assignment in this course to dig into my own history and write about my experiences of race. And for me, I grew up in South Texas, in San Antonio, in a majority Hispanic area, where I actually experienced quite a bit of bullying for being white. And so, this is something that was deep in my past at this point, and I made peace with this. And, to the extent that a person makes peace with their past, my bullies when I was a kid were Hispanic, but my best friends were too. So this wasn't some like big racial wound for me. It was just my experience of childhood. But what it showed me, and what I think that minority experiences everywhere can show you, is that there's an in-group and an out-group, and we're not immune to that because of our skin color. We find that contextually. It's different in different places. So in a place that's majority white, the black kid might be the one who feels like he stands out. In a place that's majority black, the white kid's going to feel like they stand out. And people can have these experiences across race. We shouldn't have to explain this. This is just kind of a human phenomenon. But when I wrote to my teacher about these experiences, and then she used them in class to call me out and sort of reduce and stereotype the experiences I wrote about, she drew from those journals orally when responding to things that I said in class. So I might say, well, I don't know, it seems a little bit stereotypical. And then she would volunteer information that I had privately written to her, but mischaracterize it. And so she would be talking about my experiences of race as a kid, and that I really needed to go back and reparent myself. And it was this very and now I'm sitting there if I try to talk about these experiences in the way that defends me, I'm going to play right back. I'm going to play into your victim narratives that you're trying to establish, but I'm going to try to reverse the victim standpoint. So in order to defend myself, you're putting me on the spot and making me say, no, I was a victim of racism. And here's why white people can be victims too. But I reject that entire narrative. And I don't find that personally useful. And I don't find it useful in the context of counseling either. So I felt very exposed, and I felt like very personal parts of me. I wrote about, for instance, there was this thing about domestic violence and how this happens to Black women. And we're supposed to write about this. And I'm like, well, I was a victim of domestic violence, and this was my situation, and this is how it felt for me. And I don't know if I agree that, white women's tears are whatever, so it's just trying to humanize this using myself as a story was an invitation into the victim mindset. And rejecting that. I had two choices. I could either be a bigot and a perpetrator, or I could be a victim. And I didn't want to be either one of those. And I didn't see myself as either one of those. And so the teacher, this process of inviting that level of personal vulnerability and exposure, and then using it against the individual. Again, I find this to be an incredibly psychologically abusive process. And I'm not sure what your question was. I kind of started rambling and I forgot your question.
Absolutely fine, because I think what you're drawing up, and I kind of want to scope back out as well. Christine, my original question, kind of what brought you to this space. But no, it's fantastic, because you're really giving me a sense of the way in which they used their suppositions. Again, there's a lot of this comes back for me about kind of a moral hierarchical in-group, as you said, in-group, out-group dynamic, where they're ascribing and prescribing what is considered acceptable and good based upon these implicit and explicit behaviors. And one of the things that stood out for you was that calling out experience, where they're using your personal narrative that you wrote anonymously, is what I'm hearing.
Well, it was supposed to be confidential. In fact, we were told the information that you send in your journals will not be shared with anyone unless it seems that you're a threat to yourself or others, which is standard therapy confidentiality stuff. So this was actually in our syllabus. This is not to be shared unless you're suicidal or homicidal. Really.
Ethics codes be damned. They're stepping over that.
Yeah.
They're walking into this space where they're creating a caricature out of you, using it for their own ends, or at least interpreting it through their own lens. And you have a choice. You can either be part of the bigoted oppressor narrative, or you can try and choose a victimhood status. That's what it felt like they kind of put you in, is this damned if you do, damned if you don't position. And regardless, it sounds like, of whichever position you would have taken, you inherently are part of some sort of, and we can get into this a little bit further. I'm jumping ahead with prior knowledge to some degree. Being in that position of, no matter what you do, you're going to be put in kind of this oppressor, because they're creating this privilege hierarchy from the outset, as you're saying. There is no way out of this other than, in my mind, to either imbibe it completely, or to completely try and reject. There's just no way out. There's no good way out. And Christine, I just want to back up a little bit here, because you were experiencing this around the same time, if I remember correctly, but from the academic side of it as a professor.
Yeah.
I was wondering, tell me a little bit about what what were the initial glimpses? How long were you in academia prior to starting to notice the shift? What were you noticing, and when did it start to really change for you, where you went, okay, something's going on here?
Yeah. Well, that's a good place to start. I have an interesting perspective on my experience because the same school that I taught at was the same school I attended as a student 15 years prior. So there was an experience as a graduate student in classes and getting through the program. And what diversity meant back then had radically changed by the time I came back to teach. So back then, the idea was we're a diverse group of people. Let's listen to each other's stories and let's honor people's experiences. Let's not force feed stereotypes or what we think somebody has experienced because of the color of their skin or because of their sex or their sexual orientation and nationality, creed, etc. So the word diversity and therapy intersected beautifully because it was all about being curious and wondering when you're with your client and not assuming that because they're Black or because they're Latino or because they're Middle Eastern or white, that they've had one particular kind of experience. It was about being open to the fact that just because they present a certain way, it doesn't mean that you can assume what their life looks like or what they've been through. So diversity back then was a really positive experience. And I remember being in a class that was taught back then, it's still being taught today. It's radically changed. And it was by a Black professor. And he was one of the Little Rock Nine. So when schools were finally integrated in Little Rock, I guess, is it Arkansas? Is that right? Little Rock, Arkansas. He was one of the first Black kids to integrate into an all-white school. So he had a very interesting life history. It was sort of an honor to take a class by him. He was the reason I decided to pursue the master's in clinical psychology rather than organizational development, which would have meant I would have gone into a more corporate structure where I would have been involved in, coaching executives and creating workspace, happiness or whatever. So those were the two paths. In this class, you had to take no matter which path you were on. And it was called Society and the Individual. So that was great. And it was what, and my professor at the time was like, stereotypes be damned. Like, that's not what we do here. We want to hear from everybody's individual experience. And I was very comfortable sharing with my classmates what I had been through and what my experiences were in various areas of my life, but we didn't solely focus on race. We didn't solely focus on gender. We focused on all the components that created us and that were included in our environment, in our culture and our families and where we worked and, things like that. So I felt that it was a really well-rounded, experience of diversity. So I was okay. I was great. I moved on, graduated, and I worked in grief initially. That's where I first started. And the thing about working in grief, especially where I was working at the time, is that we would run grief support groups, but they were run by volunteers. So the clinical staff had to train the volunteers on how to run the groups. And what we always said from day one was, we do not rank pain here. We do not rank pain. So we do not say that somebody's experience of death or grief is worse or better than somebody else's. It's their experience and it's what they particularly have to bring to the table. So when we started hearing things like, well, this person, though, was wealthy, so that at least they had money, or this person had 4 other kids, whereas this other person was a single mom, we'd say, stop right there. That does not define the experience of grief in the way that you're assuming it to be. Let's ask and explore what those families went through. And time again, I would hear in groups that I ran, where people would say, I would give up, my everything I have and everything I own to have my child back, my child who's died. Right. So that was what we were really, trying to get the volunteers to do too. And it was no surprise to me that because we brought these people together who had a common experience that had nothing to do with identity politics, those people naturally bonded. So you had the rich family and the poor family and the Black family and everybody in between that did not rank pain in group themselves. They didn't do it to each other. We were trying to prepare that might happen, and they themselves didn't. They found the healing and the connection and the growth and the support through this common, shared experience that they had, which was, their child died or their partner or spouse died. We had multiple types of groups. And so that is what I went into further practicing my own, as I started to shape my own practice and my own philosophies about mental health and specifically grief, because that's where I started. I later on went into addiction and other kinds of work. But coincidentally, that when I was working at that organization, a position opened up at the school where I taught, or not where I went to go teach, where I had also gone to school at, and it was to teach. I was an adjunct, faculty at that point to teach a grief class because there was no grief training in these graduate programs, and grief is everywhere. Everybody's going to experience a death at some point in their life. It's just the natural life cycle and natural stages of life. So I went there and I started teaching this grief class, and I didn't come up against any issues. This was in 2016. I didn't have any issues in my class that were that pronounced when it came to, who's had it worse, who's more marginalized, who's the oppressor, who's the oppressed. In fact, a case study that I had them study in the grief class included, it was a white family. And I did that on purpose. I was very specific. It was a white family who had money because I wanted them to confront, the fact that you can't say that their experience was any less painful because they're white or because they had money. So I challenged them in a lot of ways to not rank pain and to sometimes write about these case studies where you might in yourself feel like, well, gosh, they must be in better condition than this family. This family is more marginalized. I didn't want that in my classroom. I wanted them to see the humanness despite everything else that was around them. What makes them human? That shared humanity, because that's what creates rapport. That's what creates relationship. And that's what creates healing. And the diversity of one's experience and one's life is folded into that and appreciated by the other person, rather than in some way dismissed in the case of the white person, or overly assigned a marginalized title or characteristic to the person of color. I wanted all of that to not be the factors when you're sitting with your client in the room. Whether you're doing a grief group or you're in a client with the room, you are there on the first commonality and point of empathy and compassion comes from there's one human being sitting with another human being, most likely who's experienced probably betrayal and loss and pain and depression and anxiety and some good things, good relationships. Maybe they, have a great job. All of the varied human experiences that we've had, we can connect on that level of being able to say, well, it doesn't matter what the circumstances were. This person has felt betrayed. I felt betrayed myself, right? There's a human point of compassion and empathy that comes from just being able to see that from one person to another, regardless of their identity. So
it's and I'm sorry to cut you off there, but I think something that you highlighted for me is in that 15 years between when you were getting your education at Antioch and when you started teaching there, I'm hearing the qualitative shift in terms of the definition of what diversity means.
Yes.
And also from what Leslie was describing, but also this shift in terms of almost like a philosophical or therapeutic sensibility frame of reference, where you're going from, as you describe kind of things like human existentials, I always think of them as so multifaceted that intersectionality doesn't hold a candle to it. I mean, really, terms of personal internal experience, map that out with interpersonal, map that out with social, map that out with cultural, keep going and going, is so much more complex and nuanced than what I heard Leslie describing earlier, which is this breaking people down into these identity categories and really fundamentally creating this the narrowest of apertures.
Yes.
Quite often when I hear these types of rhetoric that are popular now, I often think of the grieving client, the person who's coming in the room. We're talking about a fundamental aspect of life, birth, death, coming in the room and wanting to talk about something that is inherent to all of us. I don't know anyone who's immortal. I've never met them. And I'm pretty sure that's a conversation that, regardless of what your background is, you're going to need someone who can understand your personal experience with it, not through the frame of reference of the identity group you hold,
Yeah.
but through your own personal, we privilege the intrapsychic experience.
And that's where I was. And I think in a lot of ways, I kind of got away with that without having to introduce critical social justice and some of the experiences that Leslie's had. Some of the students I was an advisor to had come to me saying similar things. Why I got away with it is because I'm a woman and I'm of color. So they were more likely to listen. And that bothered me too, by the way, because I felt like my voice shouldn't be more respected because I'm not white. That's really not fair. What needs to be respected is merit, right? So I don't want to be a DEI hire. I don't want to be somebody who's allowed to say more than the other person just because of the fact that I have dark skin and I'm not white. I didn't want that to be the reason that I got to say that I got to speak out more, or that I could get away with doing things like giving case studies about families that were white, that had experienced the death of a child, and all the components that go into that. But as I started teaching more and more, I began acquiring more and more different types of classes. So I wasn't just teaching grief anymore. They asked me, wow, your reviews are so great and wonderful, whatever. Do you want to start teaching some other courses? So I said, sure. And that was around 2018, 2019. That's when I started to see much more behind the curtain what was going on, because at that point I had been given an office in the clinical psychology department. So great, I have an office now. I went up to my office for the first time, and all I see everywhere is Pride Day flags, intolerance is not tolerated or whatever. Fifth, okay, like posters that had fifth. And the aggression that I felt just stepping into the space where the department was living, I felt myself tense up, and I felt extremely intimidated. I felt like, I actually questioned whether or not I should be working there. Do I even know what I'm talking about? Because all of this stuff with this identity politics and all of these things that the school stands for, I've never had an issue with that in my courses. And I've never really included those things in my courses in that kind of a fashion. I was teaching people how to be therapists, not how to be activists. And with that came being able to work with a variety of people, not shutting out one whole entire group or multiple groups or the people who voted for Trump. That was the big thing, is that students didn't want, and this was around 2018, 2019, they didn't want to work with clients who voted for Trump. As a matter of fact, one of the case studies I did in my family therapy class was about a family who, it was a true story. And this story happened in 2016. This family, they made a movie of it. I can't remember the name at the moment. Their son was gay, and the father was trying to send the son to conversion camp. And I used that particular case, or that particular story, on purpose, because the way that I saw it is this: you're going to come across Hispanic and Latino families who are very conservative and don't believe in having a gay child. So while you're sitting here thinking about all of these different, components that, we need to pay attention to the fact that they're marginalized, you're going to have some families that are going to come in that are not white, that have less tolerance for gay, for trans, for transgender, all of that stuff. Just because we live in Los Angeles and we're a multicultural area does not mean your clients are all going to feel that way. So I want you to look at this case and tell me how you would work with this family. What would you do with this family to bring empathy and healing and acceptance and love and care, not destruction, not damage, not turning the kid against the parents, not turning the parents against the kid, not trying to change minds, but trying to bring some love and attachment and peace and strength into the family bond. Because I guarantee you will have a family for family therapy that has a gay child, and they are not a white family and they don't support that. They're a Black family, perhaps. I guarantee you. So that's why we're going to do this the opposite direction. We're going to do this with a family that's white, because you're going to have to contend, with whomever comes, how they present. I had students that boycotted the assignment. They weren't willing to do it. And I basically said, you don't have an option in my class. In my class, I don't play this kind of game here. You need to understand what's actually out there in the world, and you need to know how to work with it, and you need to find compassion. That means digging deep, very, very deep, but you need to do it. Because when you can see that humanism in somebody else, then you can start treating them like a human being that has multifacets to who they are, and you can start to have true empathy. That's where it begins. So I'm going to give you this case. And the students all did it. Okay, they all did it. I forced them, they all did it. However, I started to notice that I was becoming more and more anxious with doing things like that as time went on, because I started to get feedback about not being diverse enough. I started getting feedback about not talking about marginalization and intersectionality, that I wasn't focusing on that enough. And I started to kind of see pieces of that come out. I still had tremendously high ratings and whatever. That's when I started to think, okay, well, this has actually, the psychology department has actually infused these students' classes with all of this nonsense. And I see it because I have my office here in this space where I don't even feel comfortable walking through, because it feels very angry and aggressive. And my neighbor, office mate, was transgender actually, and had the full surgery transition, and taught a human sexuality course. And he told me that when he taught the course and they brought up sexuality among heterosexual males, the students boycotted. They went to the administration, and they refused to have that topic covered in class, because it was men who were heterosexual. It didn't matter what race at that point, but heterosexual males. That's when
Let me slow you down a little bit, because it sounds like I'm hearing as things progress, you are still, as you're doing your grief course, you're focusing on teaching the fundamentals of what I would call an open frame disposition to empathy. There wasn't a selective component to the empathy, though, as it sounds like as a relevant byproduct to kind of the cultural shifts that were taking place, you were having to focus your attention on a group that wouldn't necessarily have gotten the attention or the compassion that any group previously in the former definition of diversity would have, that philosophy of non-assumption, the reduction of stereotypes. And you're feeling this increased aggression. You're seeing the propaganda on the walls, quite literally, which, in a different time, in a different space outside of that context, seeing something like a pride flag isn't necessarily a red flag, so to speak, but I'm hearing the way in which it was being presented felt almost omnipresent. And it really reminded me, it just reminds me exactly, Leslie, what you were describing in your classroom. I get this sense, and I'm always trying to get to the quality of these experiences with people, because I think quite often we can describe describe it. I'm feeling the passion coming up for you. I'm feeling a number of things coming up for myself, maybe even levels of and I'm definitely jumping and reaching here, but like the disgust of it, the sense of betrayal that comes with taking something that was supposed to be open frame and for everybody, and really collapsing the frame on who this work is for. And Leslie, you were noting that the bobbling of heads earlier. You had gone from school in 2010, originally pursuing a legal career. Is that right? You had stepped away. And you had said earlier that you were trying to get away from more of the conflictual elements of that job. Did I understand that correctly?
Yeah, the adversarial nature of law was something that I felt like if I was thinking about environmental or farm law was what I was initially thinking about. And so a couple of issues I'd worked in, I'd done some environmental work previously in San Antonio, and with a couple of nonprofit organizations there. And I had a lot of passion for some of the issues that we were dealing with. And I saw, though, a career in that as a career in contention. And I wanted to find a way to work with people, not against them. And so for me, something solution focused but positive was what I wanted. And so, this is just on a personal note, but I also just found it so wrong to set counselors up as activists. And we were told explicitly that your first role as a counselor is to be an activist, which just, I don't know how anybody can say that with a straight face.
You recall like what your early kind of suppositions were on that front? Was it a feeling? Was it something that you like had been thinking through, or is it all happening at once? I'm curious if given time and time to reflect on it, can you recall what how you were making sense of it at the time? What felt so wrong about it?
The activism prompt. Well, it just it seemed like the work of counseling is private work. It's private. It's the private space between two individuals where you as a human being have chosen to work with a professional who's going to help you focus on what is going on in your life, what is going on for you that you can't fix, where your stuck places are or your difficulties are. And this is intimate, private work. And to suggest that the work of a counselor is actually public and it's actually, excuse me, in this activist or advocacy mode is to suggest that all of my clients are kind of a monolith on whose behalf I am taking some kind of action to the public, when in fact the clients are going to be so varied. I mean, they're going to be all over the place because they're human beings. So there might be some similar themes that you start to hear. But if I try to think about my coaching clients, and I have a large roster of clients, I can hardly think of any one thing that I could make an activism out of. And what am I going to do on behalf of all these people? I guess I'm an activist for humanity, for being human to each other. So I could do that. I could try to advocate and be an activist for actually listening to individuals and thinking about people as sovereign individuals with the seeds to their own growth inside of them. So maybe I am an activist. I don't know. Now you're making me turn this whole thing inside out. But the social justice thing is just so flattening. And we were being told what we were supposed to be activists for. And so the school was really specific. It was like defund police, degender everything was another call that we were being given. So this is your activism, is to stop using the words mother and father and sister and brother and start saying parent and sibling. Stop saying husband and wife, say spouse. Stop saying woman, say person with a vulva or person with a uterus or whatever it is. So our activism was in these particular flavors and with these particular marching orders. So some of my thoughts.
It was prescriptive because we, as on the academic side, were given instructions on how to change language. So the instruction was given to us that that's what we were supposed to do. We couldn't use those words, mother and father. I continued to do that. I was a rebel, I guess, but the instruction came from the higher ups at the university, who said this is the new, and they listed, there were 87 different kinds of pronouns that came out of the University of Washington.
Yeah.
There were, we're no longer saying mother, all of that. And that was a mandate. I mean, it was a very manipulative way in which they did it, where they would write they wrote emails that said, we trust that you are supporting our mission by exchanging this word for that word, and we just trust that you're doing that, and we're so grateful that you are. Complete manipulation. It wasn't something that was aggressive, but it basically told you, put up or shut up. If you don't do this, you're going to get out, you're out of here, kind of a thing. And I think that when it changed for me and I realized I could no longer do this, I had actually, it was after George Floyd. My students were in shambles, feeling reparations, and white students crying, apologizing to the Black students. And I cut all that out of my class. Like, we're not doing all this here, because that's not what we're here for. Okay, we're here because we're trying to learn how to be good psychotherapists and have a good skill set to be able to work with people and whatnot. It was when I had a surgery that I took a leave of absence for a while. Okay, and this was after, it happened in 2021. So George Floyd kind of threw everything over a cliff, but I was marching along. I took off some time in 2021. That's when I stopped and had a moment to breathe and looked at what I was teaching. I looked at what the school was saying and the emails that we were getting about, thank God that Biden has won the election. Now we can march forward as a school. So now I started to see email after email with policy after policy that we as the academic were supposed to be so thrilled about, that were going to be imparted on us by the Biden administration. I thought, well, number one, you're a school for psychotherapy. Why are you taking a political position? That's problem number one. Problem number two, you don't know if your students or other faculty voted for Trump or whoever was running for the Green Party or anybody else. So that's an assumption you cannot make. Number three, I'm absolutely disgusted. I'm not going to play this politics game. This isn't what I'm here for. I would have went into politics or went into activism if that's what I wanted to be doing. So when they started taking positions politically very vocally and talked about how Trump, we need to heal from the previous administration because race relations right now are so tense, and that's because of what the previous administration did, I stopped and thought, I can't do this anymore. And I came across an organization called FAIR. Because of that organization and what they were doing, I was able to leave my job and have another job waiting for me that wasn't going to be about critical social justice, but where I would still be able to use the skill set that I had, and I might be able to do a little bit of teaching, which I really loved and had a passion for. So that, part of it was so critical for me. It was that the school was taking a firm position on government policy, and that needed to be folded into the curriculum somehow. That's when, right, I had to
push it too far.
Yeah, I had to leave.
And so it's like, as I'm listening to you guys describe it, I'm reflecting on both kind of literature I'm familiar with, my own personal experiences, and I'm hearing you both describe this very slow process, if you will, of altering the way in which you conduct yourself, both in a relational way, with your peers, the kind of language you're using, what's considered acceptable language, what's considered to be best for the group, for the collective, so to speak. But what I always find so interesting about this is I'm hearing the marching orders, I'm hearing the prescription. Here's what you say, here's what you do, here's our mission. But is there any sense from either the side as a professor or the side as a student what the activist mission is fundamentally? Like, and I don't mean from the literature, I don't mean from what we've read and what the, what some of the progenitors of this movement have spoken about, but from the people who are actually kind of the cultural rhetoricians, the people reciting this, is there a sense from them that they know what it is that?
Well, when I resigned and I told the dean why I was resigning, his response to me is, well, a lot of other professors feel exactly the way that you do about this DE&I stuff, but we've got to teach about diversity, so I guess we're just going to teach this. That response was shocking and very disturbing, because if you don't even believe it yourself as the dean, and with all of your, professors that are under you and they're having trouble with it, except for a handful or whatever, then it's so incredibly unethical. And I'm glad I'm out if I'm not participating in that, because these people weren't even necessarily married to their belief. They were spitting out the party line, whatever they were told to spit out from the top. So we're talking about the chancellor of the school, the upper level deans, all of that. We're dispersing all of this knowledge and information and dictating what we were to do in order to be able to stay and teach there. it wasn't necessarily because all of the professors agreed. People were too afraid to speak up and didn't think they had another option other than to continue on teaching in this fashion. That pissed me off because that's an even bigger lack of integrity. At least believe the stuff you're peddling around, or
And so
don't teach it.
it's trickled down just because. Just
Yes.
because this is going down, this is what
It's just because this is what we do now. That was the answer I got.
was that the same for you, Leslie? Was that the same kind of experience you had with it? Did it feel like, well, the way you described it before, it didn't even sound like there was room to really even question it at all without having your own anonymous or personal thoughts on the subject being used against you. Did you have that sense that it was just kind of a just because marching orders? I mean, when I think of activism and therapy, I'm like, what are you activating exactly? What is the activism that is being pushed into the space? Was there like a specific definition of what you were supposed to be getting at?
Yeah, well, one specific definition was increasing racial identity salience.
Hmm.
Our activism was primarily to be carried out with our clients in the form of re-education. So you are being taught to think about, and I really liked something that you said, Michael. You had a way earlier in this conversation of summing up a couple of these phenomena in a really concise way. And I'd love to get you to talk about that more. Perhaps your frame is really nice because you talked about how it's like a pre-existing assumption of a status quo, and the way that they use language in this really tricky way. And I've tried to articulate this, but you just did like really nice job of
You remind me of what I said. It sounds like it's reusable.
yeah, I know, right? We'll have to rewind the recording.
That's right. I have a recording. I'll
yeah.
go with that. Yes.
No, but you put it really well. It's something that I've tried to talk about is this. In all the years I spent studying psychology loves to give excuses for why it does that, or not excuses, but like an exploration of why. This is how this guy came in, and then this guy came and he challenged this idea, and then we started doing it like this. And so there's this great history folded into all of your psychology education, which you notice when you study anything in the field, you kind of get this history of the thought and the progress of the psychology field. The critical theory doesn't give any history for itself at all. It's just here it is, and it's planted on top like a graft onto the other stuff. But it's this thing that you can't question. We talk like this, we have this specific linguistic style and these axioms that we don't give you room to ask questions about or wiggle around. We're just gonna, what are your pronouns? And you need to make sure you use your pronouns because it's inclusive, but no exploration of why is that necessary? Like, what does that mean? And when did we invent this? And when did we decide collectively that the consensus is that we do this thing? But so the activism was to be a vector, as the school was a vector of education for us, of a similar education for our clients. So our activism isn't on behalf of our clients. It's on behalf of the marginalized and the isms with our clients. So your activism as a counselor, primary role is to remake the worldview of the people that you work with in order to fit a social justice model. And it was I could go on, but I'll see what you want to.
Just following it down from what I was describing is that trickle down culture on the academic side to the students out into the world. I often say the ivory tower doesn't stay in the ivory tower. The professor or the student comes down to have it, have their life outside of that space, and they can go out with ideas, particularly if there's a not so hidden curriculum involved in their education, and be kind of spreading these ideas en masse. And it sounds like it wasn't just like there was going to be a byproduct of that. There was a conscious intention for you to do that, in particular with your clients. And that's an old school excess in our field of any theoretical orientation is the concern that we might exercise our influence over our client by utilizing our theoretical orientation in a way that tells them how their reality constitutes itself. And you're describing not a theoretical orientation. You're describing like a full-scale soft social theory where there wasn't a consensus as to when this thing actually became the truth. It just was. And it's being blanketed over everything with you said raising racial identity salience. And I was wondering if you guys could speak a little bit more to that. The idea, the way I understand it is kind of as it sounds, increasing the importance of somebody's particular identity marker, in this case, race. But
Mhm.
was it every identity marker that you were supposed to raise salience of? Did it matter? Did it matter to the client? Like if the client wanted to explore that?
No, it didn't matter to the client. You're supposed to, according to the critical race theory informed multicultural counseling model, you're supposed to broach race early on in the relationship with the client while you're forming the relationship. So first, preferably in the very first session.
Yes.
And so you're supposed to talk to people about your race and theirs. Like if I were to be working with Christine, be like, so Christine, I see that you are a woman of color, and I want to open up a dialogue with you about how it feels for you to be working with me, a white counselor. What does that mean for you? And if Christine says, oh, it's not really a big deal. I have lots of white friends and I just don't really think about race that much. Then I hear that as a marker of low racial identity salience. And so my job from a multicultural competency standpoint is to help her increase her racial identity salience. So I'm supposed to increase the degree to which she believes race has informed her life. How important has race been? And I'm supposed to also educate her on the relative status of her race to my race. So make sure she knows that she's marginalized and that I'm privileged. And so it's an education that you're supposed to instill in your client.
It's not what I mean by psychoeducation if I ever write it in a note. What I'm hearing describe is you start off by noting the difference between you two. You highlight the difference. You don't highlight what Christine was talking about before, the shared humanity
No.
between you. You highlight the phenotypic, the physical expression, something obvious and available to yourself. If I'm hearing you right, you are supposed to then broach the conversation in a way that increases the importance of that difference, and then in some way use that to reshape their narrative reality, how they're making sense of that identity in the context of their lived experience and their lived history.
Yep, that's your activism.
That sounds like implantation that you're describing.
Absolutely.
It's
Absolutely.
implanted. It's implanted, and it's
Yeah. This is what made me start. This was the line I couldn't cross. This stuff, I just think you're actually really harming people when you do this. What are you doing? You're engendering resentment. You're doing the opposite of building resilience. In fact, you're disrespecting your clients because she's sitting with me. She's not here to talk to me about her race. If she is, then we'll talk about race. If race is the thing that she's here to talk about because of her experiences with racism or discrimination or her sense of, how the social dynamics around that are working against her or for her, whatever it is, then that's what we're there to talk about because that's what she brought to the session. But for me to take whatever she brought to the session and set it aside in order to educate her on a racialized worldview, it's just malpractice.
Mm-hmm. And it kind of brings my mind back to kind of it's antithetical to, let's say, something like a Rogerian position, which would something akin to the good life being the total organism being able to choose the direction in that space, but also in their life theoretically if they get to that point.
Yeah.
But you are both being asked to release the snakes and also provide the snake oil all at the same time. I will tell you how you've been bitten and how the world has hurt you. And I will also be the vehicle by which I don't even know if getting over hurt is what I'm hearing you describe right now. That's what's going through my mind.
Yeah, there's no end to it though. That's the thing. You can never, the work never ends. So you're doing this work until the day you die. I mean, that's part of the ideology, is that you're continuing to work, whether you're the anti-racist, you're continuing to work to not be a racist. So that work is permanent. And if you're the person, who is the oppressed or, being targeted because of their race, you're supposed to understand that that's your position and it will not change in any meaningful way ever as we go along. That this is part of, your history and going forward. There's no end. There's no point where there's an opportunity to take some self-agency and control of your life and to step into your life in a meaningful way, because you're always going to face these obstacles. And that's not how we taught trauma treatment when I taught trauma treatment. It's how it's taught now. But it was not what I was teaching. I was teaching about resilience and what that means to the client and how, we support our clients through being able to really tell and share their story and go there with them and be in that space, and how to become resilient and to thrive, right? So that trauma doesn't further identify you the rest of your life. It doesn't have to identify who you are. It's a part of your life story, part of your life narrative, but it doesn't define who you are, and you can go on to live a meaningful life. I mean, that was part of what trauma treatment is supposed to do. But in this model, you are going to continuously be traumatized and re-traumatized, and that's your lot in life. There's no way to ever stand up and step out of that. You're always going to be the victimized. And it's such a horribly depressing thought that there's no room for growth and there's no room for self-agency, that we're trapped in the positions that have been assigned to us from some Wizard of Oz behind a curtain somewhere.
This terrible depiction of an evil Ouroboros, a snake eating its own tail, in some sense, though not to any form of enlightenment. What you both use the word resilience, and I tend to think of, and I wonder if we're thinking of it in the same way, as resilience as a predeterminate factor to the potential mastery of one's circumstances. So not necessarily that you will master the circumstances, but that you at least have developed sort of grit or some sort of fortitude that allows you to get through the natural difficulties of life, the challenges of life. Is that kind of more or less the definition that you both are thinking of when you're thinking of resilience, and the way that they weren't fostering it? Or
yeah, because part of it was becoming resilient, I guess, if that's how, I don't know if that's the right way to say it. But the thing that, was important and that I did try to drive home is that people are going to continue to face challenges. They're going to continue to face difficulty. It's going to happen. But the more resilient you are, the more we can help our clients build that. Then they have the tools and the resiliency to make it through other kinds of life difficulties. That it is inevitable that something else is going to come up in your life that's tough. But now you're equipped with some tools and some ability to move through it, no matter how challenging it might be. So absolutely, there was never a sense of like one and done, and that's it. As long as you're alive, you're continuing to grow and evolve. In what direction, that's individual. But things happen, and, maybe not that specific trauma, but there will be others. And so, this is supposed to be about developing some life, just even life skills, I guess, and how to manage, when other situations come up. But by no means did I ever want them to walk away thinking that I was saying that once they're resilient, nothing else bad's going to happen and they've conquered their life. No, it's a way, though, to develop some tools in how you can continue to move forward and how you look at your circumstances and reframe it for yourself.
Not resilience necessarily in the form of this is what you have, but this is a frame of reference by which you can make sense of your experiences across time, the ones you've already had, the ones you're having, the ones you will have. Not necessarily this thing that like I've become resilient, got it, but now
yes, because that's not possible. And that's not
this framework. No way.
There's no way for there isn't. Right.
Yeah,
so
I like Michael's definition of resilience. I think that's a good one. And I think that what they're doing with some of these theories, like Christine, you were saying, there's no absolution. There's no transcending this position of privileged or marginalized. These are just sort of permanent things. You you continue to do the work. And if you're privileged, your work is just continual self-flagellation. And if you're marginalized, then your work is just grievance and resentment and perpetuation of that grievance and resentment. And the fact that you have no agency and no responsibility for your own perspective, your own attitude, your own outlook, it's really there. It's more akin to teaching learned helplessness. which is really the opposite of resilience.
And when you were saying self-flagellation, I can't naturally help but have the association with processes of expiation where you express your guilt in one way, shape, or form, but there's getting right with yourself and getting right with a higher order. And it sounds in this case, you can never get right with the higher order and maybe never yourself fundamentally. I think there's a lot more to unpack there to understand kind of there's a religious order, but a circular religious order to that. There is no end to what you just described to me.
Yeah, there's no end.
Guys, I want to be mindful of time here because I know we've been talking for a while now. I have so many more questions, and I'm also so thankful for you guys taking the time to have this conversation. I think as things are continuing to unfold, it's important for us to be able to know what footholds got us kind of scaling this mountain in the first place. I mean, really, it's so easy to forget so much of these experiences, particularly the rich parts of how you were making sense of it at like a very deep, let's say, phenomenological level, your personal level. And so I really appreciate you both side by side, former professor, former graduate student from the same institution, but different locations, if I remember correctly. I know
That's right.
Really being able to compare side by side, it gives for me, it gives a very rich constellation of kind of how things were forming and how different pieces of information and ideas may be getting passed around our field in ways that maybe people are conscious of, maybe they're not conscious of. It probably is case dependent, but thank you both so much for this. And thank you both. I hope, I know I don't speak for just myself on this, and I meant it when I said it when we first started speaking. You both provided a place for people like me and so many others, and you continue to provide that place where they can know, hey, I am not just the person in the room where everybody's nodding and I'm losing my mind and I'm outside of the group. I think there still is a silent yet majority viewpoint that is more nuanced and still available to us in this field. A conversation perhaps for another time. But thank you both so much. And I really appreciate it.
Thank you, Michael. It's nice to see both of you. It's a great conversation. Thank you very much.
Great to see you too.